Hi, this is Jeana at Artist Skincare. Welcome to my show today. We're going to be talking about collagen induction, and we're going to be doing that with microneedling. So I'm going to show you some different microneedling techniques today, and we're going to do an entire microneedling facial that you can do on yourself at home to induce your skin to create more collagen. First thing we need to do is wash our face. So today I'm using the AnteAGE cleanser. This is a really nice gel cleanser. You want to use a gel cleanser when you're doing microneedling because you want to have a very clean rinse. You don't want to have any residues or any oils left on the skin when you are doing your microneedling. So I'm using the AnteAGE cleanser today. I love it. It's a zeolite cleanser. Zeolite is a detoxification element, so it really helps to pull toxins out of the skin and neutralize them. Now, before doing any microneedling, of course you cleanse, as we did, and then you also want to do a light exfoliation. So AnteAGE has really come up with the perfect system for microneedling. We're going to be using their cleanser, their enzyme, and we're going to use their microneedling solutions today. I'm going to be using Regenazyme. It's an enzyme from AnteAGE. Enzymes digest away the dull, dry, dead skin cells on the surface of your skin so that your moisturizers lay better, your serums can penetrate better, your makeup looks better. It just gives the skin that nice, fresh look, so you don't have those dry cells just hanging out there on the surface. I'm going to use a brush today. You can use your fingers or a brush. Just want to use a brush when I'm doing a video because then I'm not getting it all over my fingers. Now, while these enzymes are sitting here on my skin, let's talk about the different devices that you can use for microneedling or for collagen induction therapy. So I've got three choices here today, and I'm going to show you how to use each one. We have the MTS micro roller, and this has little needles on a rolling ball that rolls over the skin. So I'll be demonstrating for you how to use that. This is probably the most advanced form that I'm going to show you today. I'm kind of going backwards. This is for those most advanced users and who really want to get a really good needling treatment in, really thorough. In my opinion, it's probably the most painful of the three methods that I will show you today. And even though I say it's most painful, it's not that painful. But if there's any of you that are afraid of needles, not sure about it, I'll show you some alternatives here as we go. So the needling device I will be showing you is the MTS. This is the top of the line. Titanium needles permanently in the roll, so you don't have to worry about them breaking off, and your skin stays sharp the longest. You can actually use this twice a month for 6 months, so it's really good for 12 uses. The next device I will show you, the next level down, is a channeling device. This is a stamp. The stamp, in my opinion, and most people's opinion, is less painful. There are little tiny needles on the top of this. We're going to be stamping on the skin. And as your endorphins get going and you're stamping, you'll find that you're able to go a bit harder, a little bit deeper in each area. And this gives a really nice treatment. This device does not last as long as an MTS. In fact, the manufacturer recommends that you throw it away after each use. So if you're doing a really thorough job with this device, with the stamp, you're going to throw it away and use a new one for your next time. If you're just doing a little spot treating certain small areas, you might be able to get away with using it a little bit longer before throwing it away. If you do both of these devices, if you're going to reuse them, you've got to clean them with a 70% alcohol solution. You'll fill up a little cup or, fill up a little glass or cup, put it in, stir it around, and then take it out and let it air dry. Now, the third and most friendly way of doing our collagen induction therapy is with our Skin Wand Nano Infusion device. The Skin Wand has 3 settings. When we're wanting to do a really deep nano infusion like we would do with needling, we're going to use the 3rd setting. So you can see here there's a blue light, then a green light, and there is a red light. The red light is the one to use if you are doing want to do a more similar treatment to an actual microneedling treatment. There are little needles on this, but they are not metal. They're not titanium. They are actually a silicone needle. And so they don't break the skin. However, they do make the skin more permeable. An example would be if I were to fill up a balloon for you full of water and run this over it, you would see water seeping out of the balloon. So it's making little microchannels. It's making that skin more permeable, but it's not actually creating actual holes in the skin. Although you have to imagine it is making a little bit of a hole. It's just so small. It's just making the skin more permeable and not really causing the same kind of wound that you would with an actual needling device. So this is the most friendly, especially for people who are adverse to using needles. This is a great option. All three of these will make your skin peel usually the next day or the day after. You're going to see some of that dead skin rolling off the skin because it has disrupted that skin barrier. Now, if you are an esthetician and you're watching the show today, these three tools and techniques are an excellent way to introduce microneedling to your clients, starting with the nanofusion device, getting them used to that. Now, if you're in the state of California, you're not allowed to use needles, but you can use a nano infusion wand. So you can still do this treatment and get excellent results using the skin wand. Now, whenever you microneedle, doing any kind of microneedling, stamping, nano infusion, you want the skin to be dry, and then you want to use a serum or solution on the skin and keep the skin wet as you are needling the skin. So AnteAGE is fabulous. They make 4 different solutions that you can use for home microneedling. So I want to give you guys an idea of what these solutions are and the difference between them. The first one I'm going to show you is their original, and it's called the home microneedling solution. Comes alone by itself, or it comes in a kit. Comes with 5 of these little 2 ml vials with a roller ball. This one in particular is used for wound healing and all around anti-aging. Many clients get this who've had a wound to the skin or have had surgery. This is the one that really is anti-inflammatory and is going to help the most with wound healing. It's also very good for anyone who has really sensitive skin or reactive skin because the ingredients are very simple in this solution. So less likely to create a reaction in the skin. The next solution that they have is their anti-aging solution. And you can see on this one, they call it microchanneling solution. This one was called microneedling solution. They both can be used interchangeably for needling or microchanneling. So this one is the same idea. You have 5 vials and you'll use 1 per each treatment. And the anti-aging solution has more peptides in it and specific growth factors that are going to go after lines and wrinkles in the skin. So that's what makes this one the anti-aging. Lines and wrinkles, keep that in mind. Now the next one I want to show you is the brightening. The brightening is enhanced so that it creates, so it's very good. I'm going to use it today. It's very good for people who have dark pigmentation spots, who want to even out the pigmentation on their skin. So that's what the brightening is for. Then we also have a clarifying solution. The clarifying solution is boosted so that it's anti-inflammatory, but it also helps with breakouts. So it's going to calm inflammation, breakouts. It's going to help the skin to heal faster. And in particular, it's going to be good for preventing and helping with scarring on the skin after blemishes. You do not use this while you have active inflamed blemishes. This is to be used after that is mostly healed. The skin is smooth. You don't have a pustule or an inflamed pimple there. It's to be used after that to help with that healing. You know, whenever you have a breakout, especially a big one, when it goes away, you're often left with that dark purple mark that lasts 6 to 9 months, sometimes even a year. What that means is there's still blood flow to that area because the skin is still trying to heal those deeper layers. This is where this solution comes in so handy with microneedling because it's going to speed up that healing process. Today we're going to do the Skin Wand Nano Infusion device, and I'm using AnteAGE Brightening Serum. And I'm going to be working this into my skin to help relieve dark spots in my skin and also to induce collagen, get more collagen being produced on the skin. So let's start on the forehead. When you apply these bottles, you'll see they're a little bit frustrating. If you're holding to the side this way and trying to roll on, it doesn't go on really great. It's generally better if the bottle's facing down. So when I'm rolling it on, I'm tipping my head back and rolling it onto that area that I am going to work. And it's very, very light. It's a very light solution. So sometimes when you roll it on, you feel like, oh, it's so hard to get this thing out and going. So I've turned on my device, I've turned on my Skin Wand. I'm gonna turn it up to the highest level because I wanna get the most penetration today. I'm doing a special nano infusion facial. So I'm gonna go up and down on this area. I want to go side to side. And I can also do little circles, just really working this into that area. I'm going to keep doing the same area until the skin is a little pink. I'm using very light pressure. I'm not really pushing it down into the skin. I'm letting the device do the work for me. By using my nano infusion device, we're really pushing this serum down into the skin. Any of these solutions for microneedling can be put straight on your skin and will be beneficial. But when you're doing it with a nano infusion pen or microneedling device, it's really pushing it further into the skin. So now I'm going to move over and do the other side of my forehead. Yeah, nice and wet. This is so great for those lines on the forehead, or if your forehead is getting too much texture or dark spots, this is going to be great. I want just a little more on there. I want to have a little more moisture on there. There we go. It's nice and pink and it's drying out. And that is how you use your nano infusion pen. Now, if you don't want to go as deep with it and you don't want to have any little disruption of the skin barrier or any little peeling or anything the next day, just use it on a lighter setting. Don't use it on the red setting. Okay, now the next area that I'm going to do is this little cheek area and around the eyes. And this time I'm going to use the stamp. There we go. I was rolling too fast. If you have trouble getting it out, just roll slower. Okay, got that area nice and moist. And now I'm going to take my stamp and I'm just stamping generally about 5 times in each spot. When you're stamping, you don't want to scrape across the skin. It's a straight up and down motion. And I'm waiting until the skin pinks up nicely and then I will move to the next section. If I don't see it pinking up as much as I want, but the skin's drying out, I'm going to add some more of my microchanneling solution. especially this area, I really want to. It's a problem area for most people. We get the most sun damage right in this area. Now it's nice and moist. And I like to get those areas, the trouble areas, really pink, nice and pink. So I know I'm really getting my solution in there and I'm getting a nice little wound to the skin. So I'm going to really induce some collagen production on this area. Now I'm starting to get used to it, so I'm being just a little firmer with my pounding. And that's great, nice and pink along that area. Now let's go ahead and do the other side, and we're going to use the micro rolling technique with the roller. Great, got that skin nice and moist. Now when I'm using the roller, I'm using firm but gentle pressure, and I'm going to start by going up and down 5 times. Then I'm going to go sideways 5 times. Let's do both areas. And then I do a diagonal. And then the diagonal the other direction. Now, if the skin is not as pink as I want, I can come in and I can do the whole thing again. And I can also come down more into this area. And it's the same with the microneedling device. When I first start, I'm being really kind of gentle. I'm just getting used to it. And now as my endorphins get going and I'm used to that sensation, I can use a little more pressure as I do my rolling. I've got this area really nicely pinked up. And let's go ahead and do it because you can. I'm going to show you can do the orbital bone. So let's get some solution right in those brows on the orbital bone. If you have the AnteAGE brow serum, you can do this with your brow serum to induce more hair growth in that area. So I'm going to come in and do the brow, that orbital bone. Microneedling with this needle or with the stamp can also be done for hair. So if you have the Neogenesis hair serum, you could be using the microchanneling device and pushing that serum into the scalp. You could also do it with this needling, but most people find that the roller needle is just a bit too painful. I hate the roller needle on my forehead, and it feels really painful on the scalp as well because that skin is so thin. So let's go ahead and do the same thing on this side. Get this orbital bone and brow. And this time I'm going to use my stamp. Notice that I used my skin wand when I did the forehead. The forehead is the most sensitive, and needling on the forehead can bring a little tear to your eye. So I chose my nano infusion device to do the forehead. Any bony areas are going to feel more painful, more prickly when you do them. Okay, let's move down now and do this lower part of the cheeks. I've got to slow down. If I go too fast, the solution doesn't come out. There we go. Nice and slow. We'll continue. This whole side of the face is going to be my micro-channeling side. You see it's pinking up very nicely. That's great. Let's do the other side. We'll do our roller on the other side. Now, normally just use one device. I'm just using several devices so I can show you guys how the different devices work so you can do them at home. Let me slow down with my solution. There we go. Okay, so same thing here. We're going to go in different directions and 5 times in each direction. So let's start up and down in one spot. And I could do the next area up and down. And the next, and the next. And then we can come here and go horizontal. And let's do some diagonals. And let's go the other direction. And my skin is starting to dry out, so I'm going to add a little bit more solution. These are all stem cell cytokines. The different formulas are just boosted with different ingredients to boost different outcomes. So this one has the stem cells, but then it also has some brightening agents to really help stop that melanin production in the skin, balance that out, that overproduction. By pushing air in that area, if you have a hollow cheek, that can really help get a better surface. All right, let's do the lips. And the chin. Which device should I use? Let's do the nano infusion. We haven't done that one for a few minutes. Turn on my nano infusion device, turn it up to the highest setting, which is the red. Some of you may never go beyond the skin wand for nano infusion. You really don't have to go into the needling if you don't want to. This nano infusion gives you a great treatment and excellent results. Need more slip. I really want to make sure you keep that skin wet with your solution. Now, when I'm using the nano wand and I have it just on the lowest setting, I can use that with any serum that I want. Any water-based serum, no oil serums. But when you're using it on this higher setting, which is the red light, that's when you want to be more careful and you want to use ingredients that your skin will understand. So using the stem cell cytokines and growth factors, that is going to be a better thing to drive deeper into the skin than some other ingredients that aren't naturally found in the skin. I'm using my brightening, but you could also in this area, especially around the mouth, you could be using the anti-aging, because the anti-aging is what's going to go after, it's boosted to go after those little lines around the lips. The little lines anywhere on your face, the crow's feet, forehead, 11s. The anti-aging is the one that's going to have those peptides that go after those wrinkles in the skin. But if you have dark pigmentation around your mouth or any areas, The brightening complex is excellent. Let's do one more layer. And you can see I can spend more time and go over more often when I'm using my nano infusion pen, as opposed to going over with the needling, one of the needling devices. Now the only area we really haven't done is this jawline. So let's get in there and work the jowl. We get a lot of stagnation in this area, so this is really going to help with some cell turnover. Grab my microchanneling device. 5 pats in each spot, but then I do go back and I get those areas that might need a little extra work, or if I want it to be pinker. So if you're really light-handed with this and you're not pinking up, go over it a few more times. See if you can be a little more aggressive. If you don't want to be more aggressive, just do it a few more treatments. Now this area of my skin's dry, so it's really soaking up my solution. So I'm going to add some more solution on here to get underneath. Now, when I'm finished, I've done the entire face. If I have specific areas where I know I have problem areas, like on this side, I've got some dark pigment right over here and a bit right here, I can come in at the end and hit those areas one more time. So now that I've completed my rolling, I'm going to go ahead and roll my solution all over the entire face so that I have a nice coating everywhere. And I'm going to let it dry. Now I'm going to come back at this every 30 minutes for the rest of the day and keep applying my solution until it's all gone. Now, if your skin's feeling a little tight and dry, you can reapply 15 minutes later if you want. You could reapply 5 minutes later if you want. We just say, in general, reapply every 30 minutes because not everybody's going to sit there and reapply this every 10 minutes or every 15 minutes. So just making sure that you're coming in, though, and using up the rest of your bottle and reapplying so that your skin is getting all these good healing stem cell cytokines, anti-inflammatory cytokines, and in this situation, those brightening growth factors. And you're going to want to stay out of the sun for this day. This isn't a day you're going to want to go to the pool or get a heavy workout and get real sweaty. This is a day you want to spend indoors, being more sedentary. Now, one thing I didn't do is get the top of my nose. This is an area that really gets a lot of thinning. We tend to lose fat pad and collagen in this area. So let's go ahead and roll the top of my nose while we're at it. You can roll the sides of your nose. This is a technique, doing the side of my nose reminds me of one of my clients who had a skin graft. After having some cancer removed, she had a skin graft in this area, and we used this needling technique. Once that graft was healed, we used our growth factor serums, our stem cell cytokines, and we rolled, especially around the little edges, very gently around that skin graft, and that graft just melted right into the original skin, and we saw a beautiful healing result doing that. That would be something that you would want to talk to your surgeon about and make sure it's okay for you to do. But we had a great result with that. All right, I feel good about that. Got a good penetration. I still have two-thirds of a bottle in here. So normally I would have less than this, but normally I do my entire neck and I do my chest. So later today, if I want to come in and do those areas, I have enough to do that as well. Now, like I said, you're going to come back, keep reapplying throughout the day until your bottle is empty. And then you can put on moisturizer, and if you need to, you can put on a little bit of sunscreen. I love to use the AnteAGE moisturizer with this. It's very light, does not occlude the skin, feels very comfortable and very moisturizing. Once you've done that, the next morning when you get up, you can go back to your regular skincare routine, which you might do if you're using a prescription retinol or you're using some kind of strong acids on your skin. You might wait another 24 hours before putting those on your skin. All right, you guys take care, and we'll see y'all again next week.